can buy health insurance across state lines like we do with auto insurance. Can anybody here get your auto insurance from Geico? Surely we got somebody who does see it. Okay, this woman buys her auto insurance from a lizard in Bethesda, Maryland. Why is it that we can buy auto insurance across state lines but not health insurance? Health insurance is more expensive in New Jersey than it is in Connecticut. More expensive in South Dakota than it is in North Dakota, even though there are all these Scandinavian peoples there, don't you know? You're 25 years old, living in northeastern Pennsylvania, male, not smoker. Your health insurance is 1/3 the cost of somebody living 30 miles away in southwestern New York. What kind of sense does that make? A national marketed health insurance will provide more competition. And more competition means prices go down, benefits go up. We're the people who believe that why is it the small guy gets messed over all the time? Why should we let small business people join together and pool their risk so they can get the same discounts that the big guys get? Why should we do that? Food joints, or all the people who own a pharmacy, or all the people who own auto body shops. Let all the left-handed orthodox who play golf on alternate Thursdays get together and pool their risk. You know, we're the people who believe in transparency and quality. I'll tell you, this really blew my mind. In the Bush years, we ran a study in Milwaukee. Not to be back again among my Nordic peoples. I'm incidentally being inducted into the Scandinavian American Hall of Fame next week. You're welcome to come to Atlanta, North Dakota. We did a study in Milwaukee, 13 hospitals. We looked at price for the 20 most common procedures and quality measures. And guess what? We found out there was absolutely no relationship between price and quality. You'd have an operation at one hospital that would cost the procedure all in $1,200. 3 miles away at another hospital, it would be $12,000. And there was no tie to quality. We believe in free markets. And markets depend upon good information. We ought to have transparency about cost. You ought to be able to say, you know what, how good are you at that? And what's it cost? We're the people who believe, that information powers the individual. Electronic health records. That's about you. You ought to own that information, have control of that information, and be able to allow your healthcare provider to access that information. And you know what? It'll help drive down the cost of healthcare. I got to tell you, not to get too personal about it, but a couple years ago I had sinus surgery from a doc. She used to be a heart surgeon, then she started being working on sinuses. Dr. Picken, which I always thought was sort of, Dr. Picken. Remember the Seinfeld episode? Anyway, they got it. So I walk in her office. The office is run by her husband, who's a retired Navy officer, both of them in their early 40s. I walk in, I showed him my card once, filled out one piece of paper, and never saw anything again. They emailed my prescriptions to my pharmacist. I went and got an MRI, and rather than walking out with a gigantic bulky envelope, I walked out with a piece of paper that I kid you not looked like a Chinese fortune cookie. It was the URL at which she could access my record. I never saw a piece of paper. It was the best ear, nose, and throat doc in the Washington, D.C. area. It was completely paperless. And you know what he told me? I had lunch with him. I invited him over to the White House. For some reason, when he worked at the White House, he invited somebody to come to lunch at the White House. They'd come. So I invited him over after I had my nose surgery, and I said, yeah, it was a great experience. How did everything go? And I said, I'm really interested in your technology. What does it make for your business? The husband who ran the practice said, we cut the number of FTEs by 2/3. He said, we didn't need all those people in the back room anymore. He said, the second largest expense in a medical practice is your rent. We cut our rent by 1/3 because we no longer needed the back room. He said, we're paying all of our people more than we've got because we need to give them some technical training. But he said, we no longer have turnover. He said, we'd have people come and go. He said, I had to buy everybody a personal shredder because they would get the stuff, enter it in the computer, and run off the physical copy because they were used to putting in the files. And he said, every day I'd go by and say, shred this, shred this, shred this. And he says, but it has been fantastic cost savings for our business that we passed on to our customers. That was interesting. Doctor's office being run by a professional that was talking about, quote, customers. That's what we want, a patient-oriented, customer-oriented healthcare system. And finally, we're the people who think that we ought to get rid of these junk lawsuits that are driving up the cost of healthcare for every single American. We're not making pockets in the product. I used to be a states' rights guy when it came to medical liability reform. After all, we got it in Texas. And if you didn't get it in your state, that's your problem. But then I went to Washington. And we did a study in 2001 that gives us, in fact, you were on Ways and Means. You know what the cost of defensive medicine to the federal taxpayer is every year in Medicare and Medicaid? $38 billion a year. In the entire provision of health care in America, it is estimated that defensive medicine costs on the low end $60 billion, on the high end $200 billion a year. Pick a number somewhere in the middle. Think about that. That's the cost of defensive medicine, of people doing tests and procedures to protect themselves against being sued. We can't wash all of that out by medical liability reform, but we can sure wash a lot of it out. Now, my point is this. When it comes to health care, it's fine for us to be beating the Obamacare about the head and face for all the bad things that are in it. But as conservatives, we have to be willing to offer up a positive prescription, an agenda for our country and for our cause that makes sense to ordinary people. And this is the kind of thing we can do if we just simply have the courage of our convictions and take our timeless principles and apply them to the new circumstances we find ourselves in. Let me say one other thing about the economy. We better be darn clear why we got where we got. Because the other side, the liberals, are going to try and say it is a failure of capitalism. The free markets failed us. This is a problem with all these sort of Republicans and conservatives who believe in capitalism and free markets and in Adam Smith and all these dead guys who have no relevance to our world anymore. Let's be clear how we got here. We have a business cycle, which the world economy is interconnected, and things come and go in that business cycle. Sometimes times are really good, and sometimes times aren't so good. And we got in a period last year where things were sort of slowing down. But what turned the sort of minor ups and downs of the business cycle into a worldwide crisis? And let's be clear, it was not a failure of capitalism and free markets. It was a failure of government privilege. It was a failure of Fannie and Freddie. It was a failure of government private. These GSEs, government-sponsored enterprises, started in 1938 to help liquefy the mortgage market. Between 1938 and 2000, 62 years, Fannie and Freddie purchased $2 trillion worth of mortgages. Starting in the 90s, they began to sort of, get a little greedy. And they started going out there trying to make higher profits with the implicit promise that the taxpayer was going to back them up. It wasn't explicit, but it was implicit. After all, they'd been chartered by the United States Congress. They might have been private companies, but they were chartered by the United States Congress. And as a result, they were able to go out there and borrow money for about 40 or 50 basis points less than their private competitors. In 2001, we came into office, and the Clinton-era regulator came in to brief us and said, "We got a problem." He was trying to keep his job, but I appreciated his candor. "We got a problem." He said, "Fannie and Freddie are out of control." He said, "I think they're highly leveraged." At this point, they were leveraged about 15-1, which means a 6% decline in the underlying value of their assets would wipe them out.